The greater omentum in equine is considered very short compared to other domestic animals. Here is the stomach, this part. Here is the spleen. So all of this is the greater omentum. So it is considered very short and ill-developed. What is the clinical importance of the greater omentum? Since the greater omentum is very mobile, the surgeons used to tack bits of the greater omentum over the sites of opened viscera. This will help in healing. In addition, instead of fixing the viscera to the wall of the abdomen, it will be mobile. Since also the greater omentum is highly vascular, sometimes the surgeons use it to revascularize the wounds or the incisions inside the abdomen, especially in chronic cases, and this process called omentalization. The greater omentum is called policeman of the abdomen because it limits the spread of infection due to the high amount of macrophages and the lymphocytes and the immune response it gives through this milky spots and prevent the spread of the infection. Also, if there is an infection in the abdomen, the greater omentum will surround and make adhesion in the region of infection and prevent its spread. Also, the greater omentum in cases of ciliotomy, if you trace the greater omentum, it can lead you to the problem inside the abdomen. The omentum could be removed without impairing the health of the dog or any other animal. Also, the greater omentum, if it is removed, it will not regenerate. Now we will speak about the mesentery again. We know that there is dorsal mesentery here, and there is also ventral mesentery. But what happened during development? One of these mesenteries should be lost. Why? To allow the intestine to move. Imagine the intestine is suspended from dorsal part and from ventral part, so it will not move. So to move, we should either lose this ventral mesentery or the dorsal mesentery to have it move in a pendulous movement, this or this. So why we lose the ventral mesentery, not the dorsal mesentery? Because the mesentery is a bridge for the blood vessels, nerves and lymphatics, and since the aorta which will send the blood vessels is dorsal, so we should keep the dorsal mesentery and the ventral mesentery will be lost. So what will remain from the ventral mesentery? It will not be completely lost. There are still some remnants of the ventral mesentery. The first is the falciform ligament. The falciform ligament is a fold of peritoneum, begins at the umbilicus and passes to the liver, and it is present attached to the parietal surface of the liver. If we open the abdomen cranial to the umbilicus, the falciform ligament is attached to the linea alba in this region. And in the fetus, the falciform ligament carries the umbilical vein. That's why it remains. The umbilical vein, which carries the blood from the mother to the fetus, runs into or within the falciform ligament. I mean, the falciform ligament is considered to be the mesentery for the left umbilical vein. Another function in adults, we used to use stem cell in therapy, especially in orthopedic, and we can take stem cell from adipose tissue. But if we need large amount of stem cell, we can get it from the falciform ligament. This is a view cross-sectional drawing. This is the abdominal wall, and these are the abdominal muscles. This is the linea alba, and this part, this dotted line, is the parietal peritoneum, and this part is the falciform ligament, and this fat is present within the falciform ligament. In cats, the falciform ligament is less fatty, except if it is an obese cat, but generally dogs has more fat in the falciform ligament. This view shows a ventral midline incision in the abdominal cavity, and when we open, we will find this fat representing the fat in the falciform ligament. This fat, of course, can be removed to facilitate the closure of the abdominal incision. Again, here is the fat being removed from the falciform ligament. And here is the fetus to show the process of the blood vessels supplying the fetus. Here is the umbilical vein, which will become the round ligament of the liver. This runs into the falciform ligament. So the falciform ligament is attached from the umbilicus to the liver, and on its free part will run the umbilical vein. The umbilical arteries will return the blood from the fetus back to the mother. This is in the fetal and this is in the adult. Again, the remnants of the ventral mesentery. This is part of the abdominal wall. Here is the umbilicus, and this part representing the round ligament, this part, or the umbilical vein, coming from the umbilicus, going to the liver, and this fold here, this is the falciform ligament. Here is the urinary bladder. This part is the urinary bladder. And from the urinary bladder, we have two parts from the ventral mesentery. Those are the lateral ligaments. And another fold from the ventral part of the urinary bladder. So we have three ligaments here. On the lateral edge of the lateral ligaments of the urinary bladder, we will have two umbilical arteries running like this. This is the other one, going to the umbilicus to return the blood from the fetus to the mother through the placenta. So these are the lateral ligaments of urinary bladder, this one and this one, and on their free edge runs this umbilical artery. In addition, there is a third ligament for the urinary bladder, which is the median ligament of the urinary bladder, attached to the floor or the ventral surface of the urinary bladder, and this median ligament carries what is called the urachus in the fetus, which will become remnant and scar tissue at the apex of the urinary bladder in the adult animal. So, again, among the remnants of the ventral mesentery, we mentioned the falciform ligaments and the ligaments of the urinary bladder. We have two ligaments of the urinary bladder, lateral ligaments, this one and the other one. And on their edges, they carry the umbilical arteries. And in the adult, these umbilical arteries will be converted into round ligament of the bladder. So we now understand that we have different round ligaments. So now, what about the, this is a cross-section actually, drawing for the ligaments of the urinary bladder. Here is the urinary bladder, this part. And this is the middle ligament of the urinary bladder. And these are the two lateral ligaments of the urinary bladder. Those carry the umbilical arteries and their at their free edges, which will become the round ligaments of the urinary bladder in adult. And this is the middle ligament of urinary bladder. Now back to the connecting peritoneum. Still, there is another type of connecting peritoneum called the ligaments. But we heard ligaments before in musculoskeletal system. So here, as a peritoneum, it is a narrow fold of peritoneum, of connecting peritoneum, which means it is a double layer. Usually it is used for fixation between the organ and the wall of the abdomen, or sometimes from organ to organ. They serve as to fix the organs, or sometimes as a channel for blood vessels and nerves. For fixation, for example, in case of the liver, we have the triangular ligaments of the liver. In musculoskeletal system, we understood ligaments as, or define ligaments as, band of connective tissue, fibrous connective tissue, connecting bone to bone or bones or cartilages together. Example, collateral ligament of the stifle joint. Sometimes we see ligaments as cord-like structures, remnants from fetal circulation, as we just mentioned before, ligamentum arteriosum in the heart, round ligament of the liver, round ligament of the urinary bladder. In the chest, also we have the pulmonary ligament between the visceral pleura or diaphragmatic or pulmonary pleura and the diaphragmatic pleura. All of these use the same word in different locations. Another type of connecting peritoneum, which is called the fold, it is similar to ligament, but usually it contains less or low or no blood vessels. It is present between visceral organs. Example, cecocolic fold between the cecum and the colon. Cecocolic fold. Now we have some peritoneal reflections or pouches at the pelvic region. First, to identify these pouches, let us look at the positional relationships in the pelvis. We will have the most dorsal is the rectum. Ventral to it is the genital organs, either in the male or female. Then the most ventral is the urinary bladder and the urethra. So here we will see the peritoneum doesn't continue to the end to line the pelvic cavity, but it will reflect here at the rectum to make this pouch, which is called sacrorectal pouch. And on either side of the rectum, we will have this space or this fossa, which is called pararectal fossa. And ventral to the rectum, and between the rectum and the genitalia, we will have the genitovesical pouch. Then between the genitalia or genital organs and the urinary bladder, we will have the vesicogenital pouch, number 18. And ventral to the urinary bladder, and on either side of the middle ligament of the urinary bladder, or median ligament of the urinary bladder, we will have two pouches called the pubovesical pouches. So we have two pararectal fossae and we have two pubovesical pouches on either side of the median ligament of the urinary bladder. Again, this is another view showing the arrangement of the peritoneum in the pelvis. These are the pararectal fossae on either side. This is the mesorectum holding or suspending the cranial part of the rectum. The caudal part of the rectum is retroperitoneal. And here is the genitorectal pouch, this is space, number 11. And vesicogenital pouch here. And ventral to the urinary bladder here. We have the pubovesical pouch on either side of the median ligament of the urinary bladder. Another extension from the peritoneum is called vaginal process. This is a normal pouch of peritoneum evaginating into the inguinal canal. The vaginal canal is continuous with the peritoneal cavity. The vaginal process is present in all males and in the female of dog only. And in the males, this vaginal process will be modified within the scrotum and become two layers. One is called tunica vaginalis visceralis and the other one tunica vaginalis parietalis. Also, similar to other serous cavities, the vaginal cavity contains nothing except small amount of serous fluid for testicular movement. So the testis here, this is the peritoneum, and it will make this vaginal process into the inguinal canal, and the testis will escape from the abdomen to lie inside this vaginal to be covered by the vaginal process. Again, the vaginal process in the female of dogs only, in the bitch only. Even the cats do not have it. This is the cross section in the vaginal process. In the bitch, it contains the fat and the round ligament of the uterus, and in the male, it contains and surrounds the spermatic cord. This makes the end of the peritoneum.